Well, like Madhav sir said, money can't buy you happiness. I say, let it buy the misery that I enjoy. All right, thank you so much. I think I will be talking about the current status of curriculum evaluation and assessment. The basic idea, I'm working in Delhi in a 1,000-bedded hospital attached with a medical college, and I'm the D&B coordinator there. And the basic idea of this talk is to start thinking about how to think. So my task has already been made very easy by Dr. Purvi, Dr. Nayana, and Dr. Vaishali. I will be throwing a lot of concepts at you, and there are these handouts that have been given out. The details of those concepts are going to be there. So it's when I touch upon those concepts, I will not be elucidating them in great detail. Now, I do not have any financial disclosures to make for this particular presentation. Now, when we come to curriculum, we think of a document. A curriculum can mean a document, but curriculum actually is derived from the word currere, which means a race course, which means the runway on which one runs to achieve a goal. It is the path to get to a goal. It is the total structure of all the ideas and the activities, the course of studies, the methods of teaching, the extracurricular, the co-curricular activities that are there in addition to the regular program. So we talked of, curriculum. What have we got? We've got a traditional curriculum which was enunciated, a decade and a half back, and then again re-enunciated. I will not go into the details of it. So there are basically, any curriculum needs to look at the basic needs, social aspects, cultural factors, but most importantly, it needs to look at the individual talents and the ideals that are to be achieved. There are certain tasks in curriculum development which are outlined here. Now, how do we develop a curriculum? First thing, of course, is you need to diagnose the need. Is there a need to develop the curriculum in the first place? And then based on that need, you formulate the objectives. Then you plan. What is your content? How are you going to deliver the content? How are you going to organize the content? That is the planning stage. And then you select the experiences with which, the person will learn. And it does not end there. You have to go back to the drawing board, keep evaluating how effective that curriculum that you have developed is. Right now what is happening is we are training the medical students of tomorrow with the curriculum of yesterday with tools of a still older era. Luckily, the e-learning platforms were discussed, and that is a very big game changer, the simulators and the e-learning. And how do we integrate them into the curriculum? That is a very big question that we have right now. Now, what can be the orientation of the curriculum? Right now it is knowledge-centric. It is not student-centric in our case. So we've already talked of, the process of the curriculum development. Just remember that the three phases are first you develop it, then you implement it, and then you go back and you evaluate it. Implementation also has some evaluation incorporated into it, which is a monitoring. That means you're testing while it is running. It's like, when you're driving a car, you're looking at your instantaneous speeds. You're doing 20 kilometers, you're doing 70 kilometers. This is monitoring. And then at the end of reaching the destination, you say, okay, I drove 45 kilometers an hour. That is your final evaluation. So what this leads us to conclude is that any curriculum has to be continuous, it has to be comprehensive, it does not have to be abstract that something like this will happen or that thing will happen. Concrete ideas are required, and then of course it has to be cooperative. There are these 9 competencies of medical curriculum. All of us know them, all of these are discussed. Now we talk of effective communications, the basic clinical skills, lifelong learning. Now what I want to focus on is the next 3: self-aware, self-care, and personal growth. These are the aspects which are right now relegated a little to the background. which we need to bring forwards. Then of course, you'll talk of the social and community context and the moral reasoning and ethical judgment, as Dr. Ambekar has already talked of. Now, what is happening is, like Dr. Purvi said, that we are embedded in a highly cognitive, that is, give them a few facts of whatever XYZ, and then expect their behavior to change because of those facts. So we are in that cognitive and behaviorist model of learning. It is reductionist, it is not suitable for clinical settings, and I will go ahead and prove why it is so. We've already talked of the different domains of learning, the cognitive, those knowledge aspects that you learn. The psychomotor, then of course is, you internalize that knowledge, it alters the way you feel about things. So there is an affective domain that gets modified, and then of course it becomes a behavior. That is your psychomotor performance. So there was something called the Bloom's taxonomy. This was given in 1956, and what it said was, you need knowledge first of all, and then you need to comprehend that knowledge, understand it, then you need to apply it, then you need to analyze how it was applied, then you create further knowledge, and then you evaluate it. In 2001, we realized one thing, that you cannot synthesize before you learn how to evaluate. So what we did was, there was this Anderson's modification, where all these nouns became these verbs on this side. I don't know whether you can see it there. So the only thing that has gone is that evaluate. First you need to evaluate, and then you go into creating the content, right? Now this is focused on the residents very specifically. Right now what is happening is, the moment you're exposed to something, you say, okay, I can, so and so YouTuber is doing it, I will also do it. A lot of our people are also doing it, but please realize that there is a particular level of proficiency beyond which you should start working on that. And then of course, we've already talked of the factual knowledge, disconnected facts. In those disconnected facts, what are you doing? You're developing connections in those disconnected facts. Then, using those connections, now you use procedures to do things. And finally is the mega cognitive aspect that we are talking of. How to think about thinking. How to approach how we think about thinking. Of course, we've talked of the hierarchy of the cognitive domain. So basically, the knowledge is going to have, an internal structure. And the second thing it is going to have is how well it is suitable to the world outside. So it has an external validation, it has an internal validation. Psychomotor domain, Dr. Purvi is already talked about it. First you decide to act, then you start imitating another person's behavior, which in our case is, somebody senior. Then you start acting without those cues, and you modify as and when it is required. And then finally you develop procedures and processes of your own. Now that brings us to the question of curriculum evaluation. Now, who should do curriculum evaluation? Now there is no such fixed criteria that so and so will do it. When you're doing something like at the end of the procedure, or you're doing it for the bureaucrats or the common public, better to have a third party certification agency or people who are not closely connected with the process, so that there is a level of objectivity to it. But when formative assessment is there, when you're doing prescriptive, when you're looking at the curricula in a manner that you're going to, if you feel that something is missing, something is not working, and you want to reorient it, then better to get the people who are teaching, who are working within the system. How to do it? There are many models. I've already given in the handout. There's Tyler's model, there's Serivan's model. In one model, he says what you do is, there are goals, and this is the outcome. So compare the goals to the outcome. That is Tyler's model. Then he says, Serivan's is goalless. He says, let's not look at goals. We will evaluate it and have a descriptive kind of a thing. And then is, of course, one of the models which is very frequently used. It's called the CIPP model. That's content, that's input, the process, and the product. Right now what we're doing, we are just evaluating the product. We are not looking at, the processes, the inputs and the content. And then of course methods of assessment we've already covered. It could be, in the olden days it was those tests and those rubrics. Now it is possible to have real-time online examination systems which tell you on the fly how well you're performing, right? And then of course the rubrics of assessment can be debated, discussed endlessly. Then of course we are left with the question of formative versus summative assessment. Broadly, formative is something which is while the process is still going on. So when you have somebody who's his first year exam, his second, like you take an exam in first year, you take an exam in second year. Now the purpose of this exam is not to pass or fail the student. It is to understand where the training process is going wrong. So this is where we are making a huge mistake. A lot of people are making a huge mistake. They don't understand that there is a prescriptive element and a diagnostic element to formative testing, right? And then of course summative assessment that we do at the end of 3 years is actually formative assessment for curriculum evaluation. And I think that covers about everything that I wanted to talk about